At least 1 out of every 5 Americans suffers from allergies. Common causes of allergy symptoms include food allergies, such as peanut allergies or milk allergies, and seasonal allergies resulting from grass, weed, tree pollen, or various molds. Cat allergies and dog allergies can also cause miserable symptoms, such as itchy eyes, sneezing, nasal congestion, and wheezing. Allergic skin conditions can cause a rash and itchy skin. And asthma makes breathing difficult for more than 22 million Americans. Asthma symptoms, which include coughing, wheezing, and chest tightness, are common in an asthma attack. Asthma in children is also on the rise. But with proper treatment for the symptoms of asthma, kids and adults can live well. So why combine these two into one program? Because many who suffer from one have also suffered from the other. They kind of go hand in hand. And to learn more, stay tuned to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. We begin our discussion about allergies and asthma with Dr. Jose Arias of Allergy Asthma Specialist. Welcome, Doctor.
Well, hi, thank you. Good seeing you again.
You too. Let's just start with the basics. What do asthma, allergy, and immunology specialists do?
Well, we see children and adults with allergy of all types. It could be skin allergies, it could be environmental allergies, pet allergies, food allergies. And then we also see children and adults with asthma, all types of asthma, including exercise-induced asthma. So we see a lot of athletes with that. And then the immunology part is we see children and adults with immune deficiency. In other words, their immune system is not working correctly. But this is something that they did not acquire it. They were born with it normally, but it takes many years for them to get diagnosed. For example, HIV is an immune deficiency because your immune system doesn't work properly. We don't treat those. We treat genetic immune deficiencies.
So we know what an allergy is, but I don't think I've ever heard anyone define it. Can you define an
Yes, of
allergy?
course. What allergy is, people think that they have allergies, so therefore they have a weak immune system, and it's completely the opposite. When you have allergies, your immune system is working 100 miles per hour constantly because it is responding to things that most people don't respond to: a grass, a dog, pollen, stuff like that. That most people don't respond to it. Your immune system goes crazy in response to it and releases a lot of chemical, one of which, of course, is histamine, which we know what that does, the itchy nose, itchy eyes, itchy skin. And that's why there's so many antihistamines over the counter to help with these symptoms.
So have you seen the number of things that people are allergic to increase over the years? Because it seems that every time we turn around, there's a new sensitivity to something.
Yeah, yes, you're right. Well, what we're seeing is that more people are coming in. They're being more aware, excuse me, of our field. They're becoming more aware of our field. And also, because of the global warming, the seasons for allergies are longer. They're lasting longer, anywhere between 20 days at the beginning of the season earlier and up to 10 days post season afterwards. So that's a long season. So therefore, more people are going to be feeling the symptoms from allergies and pollen.
Are there certain people who are more susceptible to allergic reactions than others?
Well, it all depends on your parents. I always said, who gave you this? Was your mom or your dad?
Okay.
Because we do not know how allergies are transmitted in asthma, but we do know that it does run in the families. Usually, if you have allergies, you got it from somebody. It could have been your grandparents or your parents, but somebody gave you this. So it normally does run in the family.
Now, is that the same for asthma as well as
The same thing with
allergies?
asthma, yes. The same thing with asthma. It can run in the family. There is no doubt about that. And usually, if you have allergies, then you are likely to develop asthma because you have allergic asthma. You get exposed to a pet or a pollen, and it can trigger your allergies, and therefore it can trigger the asthma. We call it one airway, from your nose all the way down to your lungs. It's just all the same airway. So if your nose is getting inflamed and your eyes are getting inflamed, then also your lungs are doing the same thing.
So the same way you just defined an allergy, can you define asthma for us? I mean, we know what it is, but what is the official definition?
Asthma is considered a reversible chronic inflammation of the lungs. It's reversible because it does improve on medications. It's reversible because it does get better when you use your albuterol, your rescue inhaler. And it is chronic because you could have it for life. So that's really what it is. It's a chronic reversible inflammation of the lungs.
We've heard that, oh, you'll outgrow it. So are you saying that's not true? You don't outgrow
The
allergic
only
reactions
way
or
that you
asthma?
will outgrow the asthma, based on research, is if you do not have any allergies.
Oh, okay.
Yeah, if you have allergies, you're very unlikely to outgrow your asthma. If your asthma is just maybe like an exercise-induced asthma or just asthma related to upper respiratory infections or illness, you're a little bit likely to outgrow it. But if you have allergies and asthma, you probably will keep the asthma for life.
So what can you do then? It almost sounds like it's hopeless.
Not really, not really. I mean, there is good medications for allergies. Like I said, it is chronic. It can be lifelong, but there could be, some over-the-counter medications that patients use. By the time they come to our visit, they've used eye drops, nose sprays, allergy pills, especially antihistamines, decongestants, and then there also are the prescription medications if they come to see us that they'll be able to get from us, which would be the rescue inhaler, the one you can use as needed. There's also the inhaled corticosteroids. I know that word sounds bad when you say the word steroids, but these are very tiny amounts to reduce the inflammation. And there's a lot of also what we call now biologics, which blocks the chemicals in your body that's causing the inflammation in your lungs. And some of these are being seen on TV commercials.
What about the natural route for people who say, I don't want to take drugs, whether they're prescription or what, I just don't want to do all of that. I want to do it naturally with the foods that I eat. And is that possible?
Well, the only thing that I recommend that's natural for allergies is vitamin C. Vitamin C is a natural antihistamines. Besides that, there's really not much else you can do. As far as if you don't want to use any nose sprays, you can do saline nasal spray. If you don't want to use any prescription eye drops, you can do saline eye drops. That would be as natural as you can go. There's no pill that you can take naturally to control your allergies and asthma.
So when someone comes into your office, what kinds of services do you provide?
Well, we do a thorough history. We obtain all the information, find out what triggers their allergies, what triggers their asthma, what medications they have tried, what medications have failed, because we definitely don't want to prescribe those again. And then we go through some testing. We do skin testing to find out what they're allergic to, because I always say you have to find out what you're allergic to so you can prevent it, so that way it doesn't trigger your allergies and your asthma. We also do pulmonary function tests to find out their lung capacity. We also have in our office a pheno, which is a exhale nitric oxide, and that measures directly inflammation in the lungs. So that's also something that we can do in our office to give you a full view of how your asthma and allergies are doing. And if the patient's coming in for a skin issues, because we see a lot of patients with skin issues in regards to the allergies. It could be hives or welts or contact dermatitis. We can also give them medications for that. We can also do biopsies. We do biopsies in our office, and we also can prescribe medications for those
So
conditions.
there's a lot that you
Yeah.
can do to kind of get to
Yes,
what the culprit
we can
actually
definitely
is.
help them a lot. You know, I used to tell people if there was a cure, I would have done it for myself and my children, because my children and I both have allergies and asthma. And if there was a natural route, I would be on it too, but there's not.
So with food allergies, how do you determine what you're allergic to? Is a matter of taking things away, adding things? I've heard that being done too.
You could do that, but that would take you a long time to try to figure that out. Normally, you can come into our office and you can tell us what you think are the foods that are bothering you, and we can do a full panel of food testing and then take it from there. And then go back and say, well, okay, you're positive to avocado. What happens when you eat an avocado? You're positive to a banana. What happens when you eat a banana? Oh, my mouth becomes itchy, or my throat becomes itchy, or I start having problems breathing. Then obviously that's something you have to avoid. A lot of times people eat so many foods all at once that it's very hard for them to pinpoint it.
Okay, so we need a guide to kind of help us
The
with
guy,
that.
exactly,
And you're
exactly.
that guide.
Yes.
Okay.
I hope. I hope.
Well, thank you for shedding some light on that, especially the definitions, because I think you're right. Most people think there's something wrong with their system. You're saying it's just going into overdrive. So
It's
thank you
on
for clearing
overdrive
that up.
all the time.
Okay.
Exactly.
Thank you, Dr. Arias. We will be back with more. Stay with us. We're continuing our discussion with Dr. Stephen Dinetz from Nemours Children's Health. He is a pediatric allergist, and he's here to talk about how asthma and allergies can affect children in particular and, of course, their families. Dr. Dinetz, thanks for being with us.
Thank you so much for having me.
Tell us a little bit about what a pediatric allergist treats and does.
Pediatric allergists focus on the treatment of allergies, so abnormal immune reactions to certain things in the environment, whether they're pollen or possibly foods reacting with children causing allergic reactions. Also, we take care of certain conditions like eczema, which can be flared up by allergic sensitivities, as well as asthma, which can cause, of course, severe breathing problems for children.
Have you noticed that the number of cases of children with allergies to something is rising?
So I think that with the current COVID situation, a lot of families are very concerned about any sort of sneezing or coughing or itching that the child may have. And in general, rates of allergy have been going up over the last several years.
And to what do you attribute that? Is it more pollution? Is it chemicals in the soil from which the food is grown? Can you pinpoint a reason for that?
Well, there are a lot of theories out there right now, but nobody really knows for sure. One theory that has gotten a lot of weight to it is the hygiene hypothesis, and living in a era where we have a lot of antibacterials, it's not something that people have had throughout the course of time. And so, as we live in more antiseptic environments, the theory is that we are becoming more and more sensitive to different things in our environments. And so, because of that, we are not used to certain pollens or whatnot in our environment. And so now our reactions to certain things are now more severe and more intense.
That's fascinating because, back in the day, your mom shooed you outside to go play in the dirt. And so it was actually a way of protecting you.
Absolutely. One of my passions personally is food allergy, and there was a study few years ago that showed homes where there was a dishwasher versus hand washing the dishes, and the rates of food allergy were actually higher in the families that had a dishwasher, where this, more sterile environment actually was predisposing children to develop food allergies as opposed to hand washing. So that was a
That's
very interesting
fascinating.
study. And so I think there is a lot to that.
So now you've got a lot of teenagers cringing because their parents are going to ask them to wash the dishes by hand. Uh,
Yes. Well, I mean, hard work is good for the soul.
You mentioned your particular area of focus is food allergies. We hear a lot about dairy allergies and especially peanut allergies, which can be deadly. What are some of the others that parents should be on the lookout for, and what do you look out for?
Well, I will tell you that this really hits home to me. For my son, the weekend before I started my allergy training, actually had an anaphylactic reaction to peanut. So, as a parent, I definitely can understand how scary reactions of these kinds can be. And so, for any parent that's concerned that their child is having a reaction, I recommend that they talk to their pediatrician, and if need be, then definitely a consultation with a board certified allergist who can help figure out which food is the trigger, or possibly was it something else that maybe was confused for the reaction, because these reactions sometimes can be very complicated, and there could be multiple foods that are involved. Um,
Yeah, I sympathize with you there because my son has a peanut allergy as well, so we had to be extremely careful with him growing up. Are there ways to get your children tested?
There are actually several different ways that testing can be done. The main or the gold standard for allergy testing is an oral food challenge, which you actually, in slow incremental doses, try the food of concern. That is the definitive test. However, that can be very dangerous. So there's also options with blood testing and skin testing. And while no test is perfect, you have to be very careful with particularly the blood testing options, because there are many different types. Some have scientific backing behind it to show that they're valid. Other tests, there have been insufficient scientific studies that show that they're actually valid. So again, seeing somebody that's trained and specializes in food allergies is very important, so that way you can know what food your child is actually going to have an allergic reaction to, and what food is safe for them to eat.
Ask your pediatrician. Don't
I
take
think
it into your own hands, is what I'm hearing you say.
absolutely. I think the pediatrician is a great resource to start off with,
Hmm.
and then if need be, you and your
They're
pediatrician
sent
can
to
get
you.
to me through referral. I mean, that's mostly insurance based. Some insurances will let you come straight to the specialist, but really, I think it's a good rule of thumb to talk to your pediatrician, who's someone you trust with your child's health, and that way, if it's something that maybe, for example, looks like a food allergy that's not, such as lactose intolerance. If your
Hmm.
child is having an upset stomach, but that's not exactly a food allergy, your pediatrician is the perfect person to help tease that out.
Well,
Whereas,
well,
oh,
we
sorry, go ahead.
I wish we could keep talking because this is fascinating. So, bottom line, if you're in doubt, ask your pediatrician, get your child tested, and the pediatrician will know whether they should pick up the phone and call you.
Absolutely.
Thank you so much for being with us, Dr. Dannett.
Thank you for having me. It's been a pleasure.
Don't go away, we've got more. Allergies seem like a fact of life, especially in a climate like the one where we live. But there's a lot you can do to get tested and to find out what treatments are available. The same with asthma. What we've heard is You might not outgrow them, but they can be managed because we want you to be around to continue having healthy connections. Have a great week. We'll see you next time.